You are watching the Doctalk show.
So, yeah, so blood is
So
a is an
blood,
important.
even fluids,
Okay,
yes,
that is
because
part of the
if
medical
yes,
management.
medical management. So as you do this, you make sure that the fluids and the blood actually run fast, because usually, depending on the blood pressure
Like the
of
drip is
the
the water
drip
is
is
entering
rapid,
very.
you put the bigger needles for running the blood and for transfusion. The other thing is that there are drugs we can use to try and constrict and narrow these vessels which are pouring blood. So if a vessel kind of gets narrower, it pours less.
It pours
Yes,
less.
it
Okay.
pours less. So there are drugs that we can give.
So there's medication.
There's
Are
medication.
are these interventions available in the hospitals,
The
in the government
interventions are
hospitals?
available on and off in some hospitals, I think. At least where I work, once in a while you get it, but it's available commercially, except it's very expensive
Could be
for most of the
expensive.
people. So
So
that is why within Kampala and outside Kampala, still resuscitation is the most important.
resuscitation
Fluid,
might
blood,
be
and yes.
is a very key element in surviving a condition such as vomiting lots of blood. Remember, these when you say vomiting blood, it's not just vomiting a small amount. This can be very, very large volumes of blood. So someone would come and within a few hours their pressure is very low, they're very anemic, and if that blood is not replaced, the person may end up losing their life. So
Yes.
it's a very big issue that we're discussing. When someone vomits blood, it's not a symptom to be played around with. So in that regard, the prevention becomes also very key.
Yes. So
How can we prevent bilharzia?
So we have to, the most important is actually to prevent bilharzia.
We
And
must not get the worms
we
at all.
shouldn't get the worms or get them and get it treated early before these complications arise.
Okay.
Because once the complications arise, then you can't do much about the scars. So we've seen that it's usually because of poor sanitation, the stool gets into the water somehow, and if we can break that by people using latrines or getting their water from clean sources, but I think the most important is use of latrines, so that the stool doesn't get into the water in the first place. Yes,
Okay.
because it may be more difficult to stop people from using water. Yes, I think it's easier
There must
for
there
people
must
to
be
use
some access
latrines. Yes.
to the
To clean
toilet
water,
facilities.
of course, it's also important for people to have access to clean water rather than getting water from the lake. Yes.
Okay.
Once someone is infected, it's possible to treat bilharzia. It's actually very easy to treat, yes, because you could use a single dose of the drug or a short course of the drug treats it.
How would one know they have bilharzia?
You
That they have
can
that
do a
worm infection?
stool test to look for the eggs in stool, but also there's a test that can use urine, yes,
Okay.
to look for particles of the
Of the
worm,
eggs of the
yes,
worms.
yes, in the stool,
So these tests are available in most hospitals.
yes.
So it's always important for people
To get
routinely go
tested.
for these tests.
Yes, so
Okay.
I want to just add that for people who are living near the lakes, the problem is reinfection. So you treat and someone goes back to the water, they get infected again. So usually there is this repeated cycle of treat, reinfection, that makes it difficult.
what can such people do? I mean, if, for example, someone is a fisherman
Yes,
and their whole livelihood is to fish,
yes.
to always
So
be in the water,
sometimes
what can they do?
they just get regular deworming, maybe every year or every few years, they get this drug to try and
To kill the
to
worms
kill
and to reduce
the
further
burden.
disease.
Yes.
Okay.
Yeah. But once scarring has happened, you can't really reverse it at that point. The only thing is we can put the bands to tie off these blood vessels within the throat to prevent them from bleeding.
Okay.
But we will not have fixed the cause in the portal veins.
The cause is
So
that
the rest of
irreversible scarring
yes,
which
yes.
cannot be treated.
So we will have tied off the tributary of this flooding, but we will not have solved the main problem.
Okay, so that really emphasizes the importance of prevention, preventing one from getting bilharzia. People love to swim in the lakes. Okay, so it's important you go have yourself checked for Bilharzia. If it is present, the doctor will give you medication to treat that worm infection. If we allow these worms to continue living within us, the more they live or the more times they get exposed to water, the more we get reinfected, and the high likelihood this bilharzia is going to worsen into complications such as having very big blood vessels, eventually resulting in excessive vomiting of blood. So I think that's the key message we want to tell people.
Yes.
Go for routine checks, especially if you are the type of person who is always in contact with water, whether it is swimming, whether it is fishing or washing clothes in the water. Always go for these routine checks. It's a simple stool test. If they find the worms, they give you treatment and the worms will die.
Yes.
And that, in essence, will
The
slow
test
down.
is cheap and the treatment is cheap.
The treatments are very cheap.
Yes.
Controlling the bleeding will be very, very expensive
Yes.
compared to treating the
Treating
worms.
it in the initial stages.
Okay, so you've heard it from the experts today in studio. Bilharzia is treatable. Bilharzia is a common cause of vomiting blood. And yes, bilharzia can kill someone, especially if they vomit excess amounts of blood. So make sure you go and get checked at the hospital. Have your stool checked for likely worm infection. And it's not only bilharzia that causes the bleeding, although that was the main center of discussion.
Yes.
But it can also result from liver damage resulting from hepatitis B infection, resulting from excess alcohol, or even excess weight can result in irreversible liver damage. So these are some of the important causes of vomiting blood. Always go for your health checkup with your doctor and make sure these conditions are treated.
You are watching the Doctalk Show.
Insights from a malaria specialist.
There is a special message for special groups. One is pregnant mothers. Whenever you are pregnant, you lose immunity to malaria. You can get very severe forms of malaria and you can lose your pregnancy. And so many things can happen. So as part of antenatal care, we would like you to focus on malaria prevention. That is why in antenatal clinics, we give you a new net. And we have talked to health workers to give it early. Some have been using these nets as an incentive for you to attend antenatal and give you towards the end. That will not protect you. Again, another special group is children under 5. They get also severe malaria. So we need families to protect them, but most importantly, should there be any fever, families should seek care early. The reason is once it is severe, it is very difficult to manage. Not only difficult to manage, things like cerebral malaria leave long-term damage. Can be physical, can be behavioral, can be mental. So some violent children, attention deficits, learning difficulties is a result of damage to the brain caused by malaria. So protect your child. Let them never get severe malaria. Let them actually not get malaria.
You are watching the Doctalk Show.